Okay, and how can protein in the urine be treated? Protein in the urine is not a necessarily a pathological problem. It depends. When you get a urinalysis, the things that they are looking for are measured on a scale of 0, which is normal, to 4 plus, which is bad. That's they do that with blood. They do it with pus cells or white blood cells. They do it with red blood cells, which are blood, white blood cells, which are infection, and protein. Other things too, bilirubin and ketones are measured in that way. Now, 0 to 1 plus protein doesn't really mean anything. Protein molecules are constantly and continuously filtered through your kidneys, but the filter, the diameter of the filter or the mesh, if you will, is smaller than the protein molecules. So the protein molecules normally go through the kidneys and back into your circulation. You're never aware of any of this. If there's damage to the kidneys on a cellular level, which means think about it from the perspective of a screen door. Y'all think back to grandmother's house before air conditioning was prevalent and prominent. They'd have to open a screen door, which as long as the screen was intact would keep the bugs out and let the cool air come in. Well, you go visit as a bad little grandchild, you take your pencil and you punch holes in the screen. So now you have bigger holes that bugs can get through. Consider the protein molecules as big bugs that are now coming through and showing up in the urine. When that happens, that is a clear demonstration that there is damage to the kidneys on a cellular level. The most common etiology of that damage is diabetes or uncontrolled high blood pressure. So, because with high blood pressure, you have that screen, that mesh, that filter, and the blood pressure, every time your heart pounds, boom, 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 it's punching a hole in that mesh until you get holes that are larger than the diameter of the molecules of the protein, and the protein starts to escape, and that is an indication of that. Again, 0 to 1 plus protein doesn't mean it can be, you can get that from a hard workout. But once you get to 2 plus or higher, or if you got 3 plus, 4 plus, that is kidney disease, kidney damage that sometimes cannot be repaired. But there are things that will do that. The class of drugs that I mentioned to control your high blood pressure, ACE inhibitors and angiotensin receptor blockers, are good for kidney health. The kidney is one of the organs in your body, the liver is the other, that can regenerate and repair itself. Other organs, once damage is done, damage is done. They can't fix themselves or regenerate. But the kidneys can regenerate. The liver can regenerate. They can take 2/3 of your liver out. You can donate it to somebody or give it to a relative, and what's left will regenerate and grow, and you'll have a full-size liver in a very short period of time. The kidneys can do the same or similar. So, ACE inhibitors, angiotensin receptor blockers, allow the kidneys to repair themselves. These newer classes of diabetes medications called SGLT2 inhibitors, two name brands, Farxiga and Jardiance, both have been shown to improve kidney function, alter kidney health so the kidneys repair themselves and work better and improve proteinuria. So they're giving this medication, which is primary indication is for diabetes, to people who have kidney damage that aren't diabetic. Let's say you have kidney damage because of high blood pressure. Well, they put you on one of these medications, the SGLT2 inhibitors, Farxiga, and or Jardiance, and the kidneys will repair themselves. So the point is that you have to have enough kidney function remaining so that it can repair itself. Once you get to 4 plus, whatever, sometimes the damage is done and it can't be salvaged. So though it's a combination of things. One, control the primary disease state. If it's high blood pressure, control the blood pressure. If it's diabetes, control the blood sugar. Then those things that can help the kidneys repair themselves. The diabetes medications, SGLT2 inhibitors, the ACE inhibitor or the angiotensin receptor blocker, and drinking lots of water. Water, very important. This is the time to avoid sodas, sweet tea, anything that can insult or damage the kidneys. The sugar in sweet tea is literally like sandpaper floating around in your blood. So every time your heart pumps those sugar molecules, they're rubbing against the kidney and creating that damage. So drinking lots of water so that the kidneys can be flushed out of those contaminants and heal and repair themselves. All part of the process. It may take a few months. It may be a continuing thing. You have to continuously do this to maintain renal health. But chronic kidney disease, CKD, is oftentimes undiagnosed and untreated until it is irreparable. So I'm glad to see that at least your diagnosis have been made, and protein in the urine is the first clinical sign that there's damage to the kidneys on a cellular level. Okay, great question.